Here we're going to look at health-related measurements and fitness testing as part of your conducting client consultations. By the end of this session, you should be able to list health screening measurements that are relevant to gym-based exercise, describe some established protocols for testing that are relevant to gym, and describe the established protocols for fitness assessments that are relevant to gym-based clients. So one of the first things to test is the test appropriate for your client. This will depend on a couple of things. Firstly, their level of fitness and also their goals. So obviously if someone's trying to gain muscle, so put on weight, testing their running isn't as relevant as it could be. Assuming if they're trying to run faster, a goal that's not about running isn't going to be that relevant. So it is important to find the right test. Also, if you're looking at somebody who's not that conditioned, doing some kind of maximal test is going to be too stressful for them at that position. Things you might need to know beforehand is where are they with food and drink, when was their last consumption. That can affect activity, their physical activity levels, or have they done anything at the moment. What is their health, have they taken any medication or illness, and what clothing are they wearing, is it appropriate for the testing. In terms of test conditions, particularly if you want to get the same repeated comparable results, you might need to think carefully about these things. So we use the words validity and reliability. So validity is it appropriate and correct test for what you're trying to find out, and reliability is how are we able to repeatedly get the same results if we do it again and again. If we're to get the same results, then that is a reliable test. So you might want to consider what time of day you do it. If you do it every Friday at 11 o'clock, then the chances are the body will be back in the same point of rhythm, and there you're likely to get a comparable test. If you take a test in the morning and then in the evening, the body might be in a different state or on a different day. Take into account environmental factors like temperature and weather, particularly if you're looking at temperature or blood pressure, things like that can really affect it. Make sure you've got a private area where testing can be done, particularly if they're invasive tests like body composition, and follow all the procedures all the time. As much as possible, you've got to try and repeat exactly what you did with no changes in order to make it a valid test. You may find, particularly in some of the what's called dynamic tests, you are uncomfortable with how it's going. You may want to stop the test. So these are tests that these are the grounds for stopping tests that would make you do that. So obviously things like chest pain, angina-like symptoms, we would require emergency response. Stop the test immediately and take it from there. A big drop in systolic blood pressure. If you've increased your work rate and you've got a big drop in blood pressure, that's not what you'd expect. You're probably unlikely to find that out in the gym, to be honest. It's more of a clinical setting. Excess rise in blood pressure. So if you've gone above 250 millimeters of mercury for systolic and 115 for diastolic. Shortness of breath, wheezing, leg cramps. Claudication is like an intermittent leg pain. Signs of poor fusion, lightheadedness, contusion, pallor, cyanosis, cold or clammy skin. So basically any skin condition that's in the wrong colour or looks wrong, it doesn't seem to be responding correctly to the test. Failure of the heart rate to increase with heightened exercise. Failure to change in heart rhythm. All of those can indicate that the heart is not responding properly. If the client just doesn't want to carry on, that's fine by them. And any physical or verbal signs of severe fatigue, or any of the testing equipment fails. So any of those reasons will be good reasons for stopping the test. So what you might want to do is think about how many health related measurements you could take. Think back to your health related fitnesses. You might get things like this: heart rate, resting heart rate. I'm sure you've had your pulse taken and you see that. Yeah, you can also take height and weight, and then you can calculate BMI from the height and weight. If you're calculating BMI, make sure you get the height in meters and the weight in kilos. You can also take hip and waist measurements, or just waist measurements nowadays, and you can compare them to see coronary heart disease risk. So all of these are quite good. Other ones you might find, blood pressure is a very good indication if there's not efficient blood flow in the body. Body composition, so body fat either by caliper or by other means. Peak flow, that's a lung test. Blood sugar levels, or other circumference measures, so it could be bicep, tricep, calf, chest measurement, for example. All these can give you good information. Remember, the purpose of testing is either to establish a safety problem or to establish what level of condition we can start the training at. So have a look at the videos that we'll post up to demonstrate how to conduct the following tests, and then you can have a practice yourself if you've got equipment, or you can wait till you come in and do it then. Have a look in some researched fitness tests, see if you can find a number of protocols. There's quite a few tests that are fairly common and fairly comparable, and you might want to then focus on the advantages and disadvantages. These are some of the ones you might find. So press up test is very easy, you need very little equipment. A 1 RM or a 10 RM test is very useful for finding your training weight. Cooper run is quite good for ascertaining levels of predicted VO2 max. Rock point walk is the version you'd use for a deconditioned person or someone who can't land. Bleep test gives you an idea of aerobic capacity, as does the step test. Sit and reach gives you flexibility. Astram bike you don't often see in the gyms, but you will see them in lab testing facilities. They're very good for reproducing similar results, and a bruise test you can use as well. So if there's any there that you can do, something like a press up test or a sit up test or a wall sit, you can conduct that test and you can see how you did, and you can discuss it, how it felt with people. So you should now be able to list the health related screening measurements that are relevant to gym based clients, describe the established protocols for health screening measurements that are relevant to gym based clients, and describe the protocols for fitness assessments. So we're looking at health tests and fitness tests.